How exactly does ketamine work? Why does it work for anxiety and depression and PTSD? There are two core mechanisms that we activate when we use ketamine. The first one is the subjective experience, the psychedelic journey. The second one is how we change the brain's neurochemistry. When you come into the clinic, we have the best opportunity to curate the most positive, safe, mind and heart-opening experience that you can. Why? Because we're doing ketamine intravenously so we can control the dose. You are surrounded by a group of people that all have their own personal as well as professional experience with psychedelics and mental health. You're coming into a clinic that is set up specifically for these kinds of journeys, meaning this is not a sterile clinical setting with white crinkly paper and exam chairs. This is set up for you to have the best experience possible. We can help you relax, we can help you feel safe, we can make sure that the dose is properly adjusted. We can increase the odds dramatically that the in-clinic subjective experience that you're going to have on ketamine is the most positive one possible. The second factor that we're activating with ketamine is neurobiological. Unlike psilocybin or MDMA or LSD or ayahuasca, ketamine does not stimulate serotonin and dopamine activity in the brain. Ketamine is an NMDA receptor blocker, which means it tricks the brain into blocking those receptors that typically bind with another neurotransmitter called glutamate. And the reason that's relevant is because glutamate is the primary driver of a process called synaptogenesis. So synapto meaning synapses, genesis meaning birth. So the growth or the birth of synaptic connections. Why does that matter? Well, on some level, everything that we experience, every thought, every emotion, every bout of depression or anxiety that we have is due to a certain collections of neurons communicating with each other through synaptic connections and these neurotransmitters. So if we can leverage the fact that ketamine stimulates the growth of these synaptic connections, we get to actually choose what kind of connections we want to grow. So when it comes to gratitude, happiness, joy, forgiveness, sense of belonging, equanimity, the list goes on. These are experiences that we can intentionally stimulate, and we have given the brain the foundational substrate for those connections to take place. So we are quite literally fertilizing the brain with the very substance that it needs in order to form new connections. When we combine really positive in-clinic experiences with ongoing integration coaching over a period of time, it ends up being the most effective use of ketamine in the context of long-term healing and sustained behavior change, rather than just focusing on the ketamine, just focusing on the psychotherapy. It's about really comprehensively pulling it all together, and that's how we're able to use ketamine to do this.